Hi everyone, in this video we are going to continue on with the axial skeleton, so this will be part 2. We still need to finish up some parts of the skull, but we are going to move down into the body looking at the vertebra, the rib cage, and the tailbone. So let's go ahead and finish up the axial skeleton. Now, with the skulls, there are going to be some sutures that we have to examine. These sutures are the lines that you see here, and they allow the bone to move during the birth process. They act like an expansion joint, and they allow the bone to enlarge evenly as the brain is growing. And if the sutures are intact and the brain is growing like normal, then we get a symmetric shape for the head. So what you can see right here is one of the sutures that we're going to examine is the frontal nasal suture. This is one area right here. And then now if we move to the lateral view of the head, we can see the coronal suture, and you're going to see the coronal suture running all the way to the other side as well of the head. On top of the temporal bone, we have the squamous suture right here. So this is the squamous suture. And then not so much visible here, but you can see more lines in the back. This would be the occipital mastoid suture. And you can see the occipital mastoid suture more if we tilt the head and move it to the back, not all the way to the back, but to this side. So right here would be the occipital mastoid suture. Right here is still the squamous suture that we saw before. And then this right here is the coronal suture that we saw before as well. Now, one suture that we haven't seen yet is going to be the rhomboid suture. So this is the rhomboid suture. And if I tilt the head all the way to the back, so now that we're looking at a posterior view, you can see the rhomboid suture in more detail here. So this is the rhomboid suture. You can see the edge of the occipital mastoid suture, and right here would be the sagittal suture. So the sagittal suture is something we haven't seen yet, but the sagittal suture, wherever the coronal suture is at, that runs from one side of the head to the next in the anterior portion, there's going to be a sagittal suture that runs from the coronal suture all the way to the back, and then you can think of it splitting up into the left and right side, and this is the rhomboid suture right here. All right, now those are the sutures of the brain. Now we're going to move into the fontanelles. Fontanelles, think of these as the soft spots. There are spaces between the bones of the skull where the bone formation isn't completed yet. And again, this allows the skull to be molded during the birth process as well. And then the smaller spots at the back usually closes off by 2 to 3 months. And the larger spots, what you see here in the front, will close around 18 months. Now this right here is the anterior fontanelle. It's more in the front. And you can see this is the face right here. If I take the head and I tilt it, moving it towards the anterior, you can still see that the anterior fontanelle is right here. And this is to give you a reference of the baby's face and the ear. And then the posterior fontanelle is right here in the back. So I know we haven't seen the posterior fontanelle before, but this would be the posterior fontanelle here, and this would be the anterior fontanelle. Now, if we take the skull and we move it, so we're looking at a lateral view, we can now see the sphenoid fontanelle right here. This is the sphenoid fontanelle, and then right here in the back is the mastoid fontanelle. And of course, you have another sphenoid and mastoid fontanelles on the other side as well. This is looking at the left side of the skull. All right, so that wraps up the skull. Now let's move into the vertebra column. So the vertebra column is consisted of your vertebrae, and we are going to examine all of these vertebrae in close detail. But essentially, we can break up the vertebrae into 4 regions. You have the 7 cervical vertebra, then you have the 12 thoracic vertebra, which is going to encompass your lungs and your heart. And then you have the 5 lumbar vertebra down to the back. Now, these vertebra, it actually extends into the sacral bone. at one point the sacral bone were separated, they were vertebra as well, but then they fused together to become the sacrum. And then at the end of the sacrum you have your tailbone, which is the coxal. So essentially you can think of this as four region, but we are going to look at the 7 cervical vertebra, 12 thoracic vertebra, and 5 lumbar vertebra in detail first, because they do have some general features that they share in common. And then we're going to move into the sacrum and the coxal. So as of right now, I'll switch over to a live view and show you how to differentiate the difference between the cervical, the thoracic, and the lumbar vertebra. All right, hi everyone. We're going to look at the vertebra in closer detail. So we have the cervical vertebra. There are 7 of them. Then we have the thoracic vertebra. There are 12 of the thoracic vertebrae. And then finally, 5 lumbar vertebrae. So how you can think of it is you eat breakfast at 7, you eat lunch at 12, and then you have dinner at 5. So 7 cervical vertebra, 12 thoracic vertebra, and 5 lumbar vertebra. Now all these vertebra, they do look different, but they share some of these common characteristics. So all the vertebrae, with some exceptions, will have these features. So here we're looking at a cervical, we are looking at a thoracic vertebra. So this right here is the body. If you're looking at the vertebra in the lateral view, you can see the spinous process. The spinous process is always pointing down. The thoracic vertebra has the longest spinous process compared to all the other vertebrae. So that's, again, how you can also differentiate. So this is the spinous process. This right here going to this side and the other side, these are the transverse process. So there are 2 transverse processes, and this is one spinous process. Again, this is the body. Then you also have these 2 facets. The one on top is the superior articular facet, and the one on the bottom is the inferior articular facet. So facet is any flat surface that articulate or will connect with another thing. So you have the superior and the inferior articular facet. Going back here, this is an opening. Foramen is the word for opening. This is the vertebral foramen. Now, if we take a look at the vertebra and how they connect to one another, you can see here that this is the vertebra on the top, this is the vertebra on the bottom. You can see that the inferior articular facet of the vertebra on the top is connecting to the superior articular facet of the vertebra on the bottom. Then, if you take a look here, this opening that I mentioned before, this is the vertebral foramen. When you have a whole bunch of vertebrae connecting to one another, there's going to be the spinal nerve that runs through them. The spinal nerve runs through the vertebral canal, which is a combination of all the vertebrae that are articulating together. By itself, it is the vertebral foramen, but when you have all the vertebrae coming together, it is the vertebral canal. Then you can also see the holes that come out from the side when 2 vertebrae connect with one another. This is the intervertebral foramen, and there are going to be spinal nerve coming out of it this way as well. Some other features we need to go through is that this area right here, imagine there is a ribbon going across here. So this ribbon going across here is going to be the lamina. The lamina is a portion of the vertebra that connects the spinous process to the transverse process. So you have the lamina right here, it is this region, and then you have the lamina right here on the other side as well. So 2 lamina. Then this region right here, this is the pedicle. There's one pedicle here, there's also another pedicle here. The pedicle connects the pedicle connects the transverse process to the body, while the lamina connects the spinous process to the transverse process. And some other things to examine as well is specifically on the thoracic vertebra, there are 2 costal facets that are not seen in all the other vertebrae. You have the superior costal fossa here, the inferior costal fossa here, and the transverse costal process here. And these costal fossas is going to be the site where the rib cage are going to attach to. So we'll see an example of how the rib cage attached to the costal fossa later. Okay. Now, another way you can tell the difference between the thoracic and the lumbar vertebra is that the thoracic vertebra, the body is smaller, while the lumbar, the body is very, very big. And then remember, the thoracic vertebra is the one with the very long spinous column. One more thing to discuss is that if you take a look at the pedicle, the superior articular fossa, the transverse fossa, the spinous fossa, along with the inferior fossa, this entire region right here, with the exception of the body, this right here is the vertebral arc. It's a combination of everything that you see here that is encompassed here, with exception for the body. Another way that you can tell the difference between the thoracic and the lumbar vertebra is that the thoracic vertebra, if you look at it from the posterior region, it looks like a giraffe. And the lumbar, it looks like a moose. So that's another way you can differentiate. Okay. Now let's go back and look at the cervical vertebra. The cervical vertebra are the ones that are found coming off from the skull. There are 7 of them. So if you take a look at a typical cervical vertebra, notice that it has all the features that we just examined, but everything is a little bit smaller. It still has the body, the vertebral foramen, the spinous process, but everything is just much smaller. The 2 cervical vertebrae that I want to examine in close detail are going to be C1, which is the atlas, and C2, which is the axis. Let's go ahead and take a look at C1. This is the very first cervical vertebra. The exception to the cervical vertebra is that it does not have the spinous process. So you do not see the spinous process coming down here. And the C1, well, all of the cervical vertebra, they have these holes, as you can see. These holes are specific for the cervical vertebra. This is called the transverse foramen, transversa foramina for plural. So the transverse foramen is where nerve comes in and out. The C1, the atlas, is going to articulate with the occipital condyle of the skull that we studied earlier. This is the occipital condyle right here. So how it fits in is that you have your C1, okay? You have right here, this area right here of the C1 is going to articulate with the occipital condyle, okay? So like this. So this area, it's going to articulate with the occipital condyle, and this gives you the, this allows you to move your head up and down. So it's a nodding motion. Move your head up and down, okay? If you take a look at the C2, which is the cervical vertebra 2, this is the axis. How it fits in with the C1 is going to be right here, okay? This is how it fits in with the C1. Okay. Now, when you see here, when it fits in with the C1, it allows for your head to shake, go from side to side, okay? Now, this part is only specific for the C2. It has the dens, also known as the odonoi process, and it's only found in the C2. It's only found in C2, which is the axis, and it's going to come into contact with C1 like this, and it allows you to shake your head left and right. If you take a look at the back, instead of having the spinous process, it has the process, but it bifurcates. So this is called the bifid process. And this is another landmark that's found only in the C2. This is the bifid process right here, and it splits. The only cervical vertebra that does not have the bifurcated spinous process is going to be C1, and the very last cervical, which is the C7. If you take your head and you push your head all the way down, and you take your hand and touch the back of your neck, you can feel the spinous process of the C7. Again, the C7 does not have the bifid process is what you see here. So again, this is how C1 and C2 articulates. It allows for your head to shake, and then C1, which is the atlas, is going to articulate with the occipital condyle of your skull. It sits like this, and it allows for your head to nod. Okay. All right, let's go ahead and take a look at the lumbar vertebra. And you can see here that after the lumbar vertebra is going to be the sacral. This is also known as the sacrum. This is the sacral bone. The sacral is a fusion of 5 cervical vertebrae. And you can see here from the back portion, the posterior view of the sacral, you have the articular superior process of the sacral, and that is going to articulate with the lumbar vertebra, and it's going to sit like this. Sorry. Okay. So you can see that the inferior articulate process of the 5th lumbar vertebra is going to sit right here with the superior articular process of the sacrum bone. So this is how they connect. Okay. And again, this is the this is the superior articular process of the sacrum bone, and we will continue this in the slide PowerPoint. Hi everyone. All right, so let's welcome back and let's examine the sacrum or the sacral vertebra in a closer detail. So here is the sacrum, the bone, and it's between your hip bones. And there's going to be the anterior and posterior view that we have to examine. The difference between the anterior and the posterior view is in the posterior view, you can actually see this ridge that's going down. This ridge that's going down is called the median sacral crest. So the median sacral crest is only visible on the posterior view, and it's the midline bony ridge. And it's formed by a fusion of the spinous processes of the sacral vertebra. So if you remember the spinous process that comes out from the vertebra as shown before, now the median sacral crest, it's a fusion of all those spinous processes. All right, so let's go ahead and examine the sacral vertebra and look at the top part. So in the top part right here, you can see this process right here, the other side, and then this is the processes and how it looks like from the back. Well, as mentioned before, these are the superior articular processes here, and they are going to be connected and articulate with the thoracic vertebra, the lumbar 5. So it's articulating with that lumbar 5 region as shown in the previous video. So these are the superior articular processes, and you can see that the flat part right here, that's where the lumbar 5 is going to attach to it. And then you can see that there's this flat surface. This flat surface is called the sacral promontory, and it's more visible in the anterior view, and you can see that it is a flat surface, and it serves as an important landmark for many surgeons, particularly during procedures involving the pelvic region. And so knowing where this is at prevents them from injuring this particular region because there's a lot of nerve and vessels that run through here. And then we can also see that there are like these two wings that come out. The other name for wings is ala. So you have the ala here, and then from the posterior view, this would be the ala, and this would also be the ala as well. They're the wings. Now, on the edges of the sacral vertebra, there's this process right here and this process. So these are going to be another flat-like surface, and you can actually see it better from the lateral view. So this flat surface here, it sort of looks like the ear. So therefore, it's called the auricular surface. So this is also the auricular surface right here. It's this flat area. Again, it's more visible from the lateral view. And this auricular surface is important because it is going to articulate with the ilium, which is one of the hip bones. And if you take a look here on this diagram, you can see the auricular surface. It's connected to the hip bone. Specifically, it's connected to the ilium right here of the hip bone. So again, this right here is the auricular surface. All right. Now, coming back to this diagram, you can also see that there is this opening right here. This opening right here is called the sacral canal. And again, it's much more visible from the superior view looking down. So from the superior view looking down here, you can see the sacral promontory. And behind the sacral promontory, this is the sacral canal. The sacral canal is going to be an area where all of the pretty much it's an open passway because it's a canal. So this is where all your sacral nerves runs through. And at the end, you have the filum terminae, which is at the very end of the sacral nerve. We'll learn about this in a couple of labs, but it's going to run down the sacral canal here. And some other structures that I want to point out are the additional opening foramen. So you have the anterior view and the posterior view. So foramina is going to be the plural form, but foramen is the singular form. So you have four anterior sacral foramina on this side and then four on the other side. From the posterior view, these are the posterior sacral foramina, and then you have four on this side as well. Now, there is a difference between the anterior and posterior. It's not just how the orientation is set up as. There's going to be different nerves that leaves from the front, from the anterior sacral foramina, and there are going to be other nerves that leaves from the back via the posterior sacral foramina. It's just how the nerves split up. Now, from the anterior view, you can also see the transverse lines of fusion. These are also known as the transverse ridges. They're pretty much the horizontal lines on the sacrum. And this actually also marks the formal location of the intervertebral disc. And again, these lines represents the fusion of the five sacral vertebrae S1 through S5 when they fuse during development. And again, these transverse line of fusion are only visible from the anterior view, while from the posterior view, you have the median sacral crest. Okay, and then at the very tip of the sacrum or the sacral bones, you can see the tailbone. This is the coxal. This is found at the very end of the sacrum. And the coxal, the more common name for it is our tailbone. So this is our tailbone right here. So at the very tip, this is our tailbone. Now for human, the tailbones no longer elongate, but you can see some of our ancestors, not our ancestors, some of our close relatives, the tailbones continue to elongate. Okay, so another axial skeleton that we're going to examine is going to be looking at the thoracic cage. So the thoracic cage is important because you have all of the bones here, the sternum and the rib cage that come together in order to protect your heart and your lungs. So these bones serve as a protection for those underlying organs. Now, the first thoracic cage bone that we're going to look at is going to be the sternum, which is highlighted in green here, and it's shown in this skeletal model right here. The sternum is broken up into three parts, but all of them compose of the sternum. You have the manubrium right here, which is the very top part. The longest part is called the body, and at the very edge is called the xiphoid process. So these three collective bones together make up the sternum. Now, if we come back and look at the manubrium, which is this upper part right here, there are two notches for that. The first one right here is the jugular notch. The jugular notch serves as a crucial anatomical landmark. It's a reference point, again, for many procedures that involve the thoracic cavity area. Now, on the side of the thoracic notch, let's see, on the side of the thoracic notch, you also have the clavicular notch. So the clavicular notch is going to be right here. This is the clavicular notch. So the jugular notch is right here. There's only one, but there are two clavicular notch. There's one here, and then there's another one here. And like the name suggests, this is where the clavicle, this is where your collarbone is going to attach to. So you can see it articulating with the clavicle bone on this diagram. On this diagram, the clavicle bone, your collarbone is absent, but it's going to articulate right here to the sternum via the clavicular notch. And again, you have the manubrium, the body, and the xiphoid process. All right, still looking at the thoracic cage, but we're going to move outwards now and examine the rib cages. So we have a total of 12 rib cages. There are your true ribs, which are called the vertebro-sternal ribs. Please make sure that you write the vertebro-sternal ribs. Remember, spelling counts on the exam. So there are 7 of them. The reason why they're called the true ribs is because they are actually attached to the sternum via the costal cartilage. So if you take a look at this diagram right here, we're going to start counting from number 1 to 7. So 1, 2, 3, 4, 5, 6, and 7. Notice that the 7 vertebro-sternal ribs, they each have their own cartilage, and their costal cartilage attached to the sternum. So 1, 2, 3, 4, 5, 6, 7. Once we get to ribs 8 to 10, so 8, 9, and 10, if you take a closer look, 8, 9, and 10, they fuse together at this costal cartilage region, and then they are attached to the ribs. So that is why they're called the false rib, because they don't have their own costal cartilage. So from the inferior view, you can see right here that these are ribs 8, 9, and 10. Notice how they fuse together, then attach to the ribs, while all the previous ones above them have their own costal cartilage and attached to the rib directly. And then finally, we have ribs 11 to 12. These are called the false and floating ribs. Vertebral ribs, that's what they're called. So make sure you write vertebral ribs. And ribs 11 through 12, they are called false and floating because they are not attached directly to the sternum at all. They're found in the back, as you can see here, and they are floating. So the true ribs are the vertebro-sternal ribs. These are 1 through 7. They each have their own costal cartilage and attached to the sternum by their own individual costal cartilage. The vertebrochondral ribs, which are the false ribs 8 through 10, 8, 9, 10 here, they fuse together at one particular costal cartilage, and then that one attaches them to the sternum. And then finally, the vertebral ribs, the false and floating ribs, which are ribs 11 and 12. And you can see right here, these are 11 and 12. They are floating. They're not attached to the sternum. So that is the thoracic cage. We examined the sternum bone and the rib bones. Remember, the sternum bone is also considered a flat bone, and many times during CPR sometimes you have to crack through the sternum in order to apply that firm pressure to touch the heart itself, to recover the heart. And going on with the thoracic cage, now let's take a look at the ribs by themselves. So we studied the sternum, we studied the individual, the naming for all the 12 ribs. Now let's just take a look at one of those ribs to examine. So here is a typical rib, and we're going to go through all the features that make up the rib. So you can see here that this is the right rib that I'm taking, and you can see how the right rib here articulates with the vertebra, and you also have the left rib as well. Let's go ahead and take a look at the right. When you are examining the rib, there are going to be two regions that you want to identify first. There is a region where it's flat, and then this region here where it looks like it has been cracked, where it has been cut off because of the unevenness here. And if you take a closer look, these are actually the costal cartilage that is in this area. So it doesn't look even compared to this top region right here. And this is the costal cartilage region of the rib. So this is the costal cartilage region. This is the head region right here. And with the head region, there's going to be two faucets here. The two faucets, the two flat surface is going to articulate with the costal faucets in the vertebra that we saw earlier. Now, there's also this little bump right here. This is the tubercle. And between the tubercle and the head, you have the articular faucet. This articular faucet right here is going to articulate with the spine, with the spinous process of the thoracic. So if you take a look at it from this view, okay, you can see the head, and with the faucets here, it's going to attach to the inferior and superior faucets of these two vertebrae. And then the articular faucets is not shown, but it's going to connect to the spinous process of the vertebra. Now, this right here is the tubercle. This would be the articular faucet right here, this flat surface that binds to the transverse faucet of the spinous process. And then finally, not finally, we get to this area. So now there is forming an angle. Therefore, this is the angle of the rib. And then the entire body of the rib, this is the shaft region. And then remember, this is the costal cartilage. Now, if you take a look at the rib, and you look at it from the bottom, this is the top part, this is the bottom part, this is the superior part and the inferior part. The inferior part, it's not as smooth. There's going to be a groove in the inferior part. This is called the costal groove, and it's found in the interior portion of the rib, the bottom portion. This is the angle that we saw before. This is the head of the rib, okay? And let's see, what other structures are we examining? Yeah, this would be the head of the rib. The neck of the rib would be right here as well. And that pretty much sums up all the terms for the rib. Let's see, okay. Costal cartilage, head, this would be the neck region. So yeah, the neck region is this area. Okay, this is the neck region, and on the neck region, you're going to find the articular faucet, and it's going to articulate with the vertebra. And then you have the tubercle. This is the angle of the rib. The entire thing is the shaft. This is the costal cartilage area. And then underneath the ridge, you will find the costal groove, and that's found at the bottom. So that's another landmark that you can use to identify whether you're looking at the top view or the bottom view of the rib.